America possesses some of the most advanced medical technology in human history. Its hospitals perform procedures once considered impossible. Its researchers develop life-saving medicines. Its surgeons transplant hearts. Its scientists pioneer treatments that transform medicine across the world. Yet millions of Americans fear one thing almost as much as disease itself: the bill. For many families, a medical emergency is not only a health crisis. It is a financial crisis. A single ambulance ride can cost hundreds or even thousands of dollars. A hospital stay can erase years of savings. A serious illness can push a middle-class family into debt. In the wealthiest nation on earth, millions delay treatment because they cannot afford it. Millions skip medications. Millions avoid doctor visits. Millions live one medical emergency away from financial disaster. This is the story of American healthcare. A system admired for innovation, criticized for cost, dependent on insurance, and deeply connected to the everyday lives of more than 340 million people. This is healthcare in America. The cost of survival. The United States spends more money on healthcare than any country in the world. Far more. Each year, trillions of dollars flow through hospitals, clinics, pharmaceutical companies, insurance providers, and government healthcare programs. On average, Americans spend significantly more per person on healthcare than citizens of most developed nations. Yet spending more does not always mean receiving more. The system is extraordinarily complex. Public programs, private insurance, employer coverage, Medicare, Medicaid, veterans healthcare, children's programs, state programs, federal programs, private providers, corporate hospital systems. Every piece connected. Every piece generating costs. Every piece affecting the lives of ordinary Americans. Healthcare in America is not a single system. It is a collection of systems operating simultaneously, and navigating them can feel like learning a foreign language. Healthcare was not always organized this way.
As you can see, the holographic projection gives us a full visualization of the patient's vitals in real time.
Medical technology was limited. Insurance barely existed. Everything changed during the 20th century. Medical science advanced rapidly. Hospitals became larger. Treatments became more sophisticated. Costs increased. During World War II, employers began offering health insurance as a workplace benefit. Over time, employer-sponsored insurance became the foundation of American healthcare coverage. Millions received insurance through their jobs. The system expanded, but it also created dependence. Healthcare became linked to employment. Lose your job, you might lose your insurance. A reality that continues affecting millions today.
I don't understand how the deductible reset. This surgery was pre-approved. But look here, they denied the anesthesiologist.
What is a CPT code?
Insurance sits at the center of American healthcare. For most Americans, it determines where they can go, which doctors they can see, what treatments are covered, and how much they must pay. The concept sounds simple. Pay monthly premiums. Receive protection against large medical expenses. In practice, the reality is often far more complicated. Deductibles, copays, coinsurance, out-of-network charges, coverage limits, prior authorization, appeals, paperwork. For many patients, understanding their insurance policy is nearly as difficult as understanding the illness itself. People often discover coverage limitations only after treatment occurs. A surgery may be covered, but not the surgeon. A hospital may be covered, but not the anesthesiologist. The result can be unexpected bills that arrive weeks or months later, turning recovery into another source of stress.
We've got an incoming trauma patient, ETA 2 minutes. Is the cross-match ready?
Yes, doctor. 2 units ONEG, ready to go.
Medical emergencies rarely happen at convenient times. A heart attack, a stroke, a car accident, a severe injury. In those moments, cost is usually the last thing on a person's mind. Survival comes first. Yet the financial consequences can be staggering. Emergency transportation, diagnostic testing, hospital admission, specialists, medications. Every service generates charges. A few hours in an emergency room can produce bills reaching thousands of dollars. A major hospitalization can cost tens of thousands. For uninsured patients, the burden can be overwhelming. Even insured patients may face substantial out-of-pocket expenses. The emergency room represents one of the most dramatic examples of America's healthcare dilemma. The best technology available, at some of the highest prices in the world. Medicine saves lives. Every day, millions of Americans depend on prescription drugs, insulin, blood pressure medications, cancer treatments, antibiotics, heart medications, mental health prescriptions. For many, these drugs are not optional. They are essential for survival. Yet medication costs have become one of the most controversial aspects of American healthcare. Some patients ration doses. Others skip prescriptions entirely. Many search for discounts, compare pharmacies, cross state lines, or rely on assistance programs. The problem is especially difficult for those living with chronic illnesses, conditions requiring medication every day for years or decades. For these patients, healthcare expenses become permanent expenses, an ongoing cost attached to survival itself.
As you can see, the trend line for patient admissions is declining while expenditures are up. How does this impact our bond rating for the new wing?
We project a 2% variance if this continues.
Healthcare in America is also a business. Hospitals must generate revenue. Insurance companies manage risk. Pharmaceutical companies invest in research. Medical device manufacturers create new technologies. Every participant operates within economic realities. Supporters argue competition drives innovation. Critics argue profit incentives increase costs. Both perspectives shape the national debate. The United States leads the world in many medical breakthroughs. New treatments, advanced technologies, life-saving drugs. Yet innovation often arrives with significant expense. The question remains, how can a nation encourage medical advancement while ensuring affordability? It is a challenge that has defined American healthcare for decades. Access to healthcare depends heavily
in rural
on geography.
Healthcare access.
Major cities often contain world-class hospitals. Rural communities frequently face a different reality. Hospital closures, physician shortages, long travel distances, limited specialists. Residents may drive hours for treatment that urban patients receive within minutes. For elderly populations, the challenge becomes even greater. Transportation barriers can delay care. Preventive services become less accessible. Health outcomes suffer. The healthcare gap between urban and rural America continues widening, creating a two-tier reality within the same country. Not all illnesses are visible. Mental health conditions affect millions of Americans. Depression, anxiety, post-traumatic stress, substance use disorders, bipolar disorder, schizophrenia, and many others. For decades, mental health received less attention than physical health. That reality is changing, yet barriers remain. Provider shortages, long waiting lists, insurance limitations, social stigma. Many people who need care struggle to access it. The consequences extend beyond individuals. Families suffer. Communities suffer. Entire generations feel the impact. Mental health care has become one of the most urgent challenges facing modern America.
Your heart sounds strong and steady. We'll start you on this new medication, and I think you'll feel much better soon.
That sounds wonderful, Doc. Thank you.
America is growing older. Millions of baby boomers have entered retirement. With age comes increased healthcare needs. Medicare serves as the primary healthcare program for older Americans. For many retirees, it provides essential protection. Without it, healthcare costs would be devastating. Yet Medicare faces its own challenges. Rising costs, growing enrollment, long-term sustainability concerns. The aging population places increasing pressure on healthcare systems nationwide. How America cares for its elderly may become one of the defining questions of the 21st century.
I can't believe this is Yetra.
Look at this one. How are we supposed to pay for all of this?
Perhaps no issue better illustrates the intersection of health and finance than medical debt. Millions of Americans carry unpaid medical bills. Some owe hundreds of dollars. Others owe tens of thousands. A medical emergency can alter a family's financial future overnight. Savings disappear. Credit scores suffer. Retirement plans are delayed. Major life goals are postponed. Medical debt exists because illness often arrives unexpectedly. People cannot schedule emergencies. They cannot budget for every crisis. And when healthcare costs exceed available resources, debt becomes the consequence. For many Americans, recovery includes not only healing physically, but rebuilding financially.
You're doing very well. We are right here with you, and we're going to take excellent care of you.
Despite the challenges, millions of healthcare professionals dedicate their lives to helping others. Doctors, nurses, paramedics, technicians, therapists, caregivers, support staff. Every day, they witness humanity at its most vulnerable. They comfort patients, save lives, deliver difficult news, celebrate recoveries, and endure immense stress. The COVID-19 pandemic revealed their importance more clearly than ever. Healthcare workers became symbols of resilience. Their work remains one of the most essential pillars of American society.
The AI analysis confirms the procedure was successful, Ms. Tanaka. The regeneration is progressing ahead of schedule.
The future is already arriving. Artificial intelligence assists diagnosis. Telemedicine connects patients with doctors remotely. Robotic surgery improves precision. Genetic medicine creates personalized treatments. Technology promises remarkable possibilities. But innovation alone cannot solve every problem. Questions remain. How can healthcare become more affordable? How can access improve? How can quality remain high? The answers will shape the lives of future generations. The future of healthcare is not only about technology. It is about values, choices, and priorities.
He's gonna be fine. The surgery was a complete success.
Oh, thank God.
We are so relieved.
Healthcare in America is a story of contradictions. Extraordinary innovation, extraordinary expense, world-class treatment, complex barriers, life-saving breakthroughs, financial uncertainty. It is a system capable of remarkable achievements, yet one that continues facing difficult questions. For millions of Americans, healthcare is more than a political issue, more than an economic issue, more than a policy debate. It is deeply personal, because when illness arrives, nothing matters more than receiving care. And when survival depends on treatment, the true cost of healthcare becomes impossible to ignore. The future of American healthcare remains unwritten. But one truth is certain. Every statistic represents a human life. Every bill represents a family. And every healthcare decision shapes the future of a nation.
Yeah.